Hello, my name is Lisa Abia Smith, and I'm the Director of Education at the Jordan Sittser Museum of Art, which is located on the campus at the University of Oregon in Eugene, Oregon. I'm also a faculty member in the College of Design, where I teach courses in the arena of arts and healthcare and arts management. Welcome to Tech Talk, brought to you by the Center for Learning and Innovation at Pullman Regional Hospital. I manage a program called Art Heals and Art is the Prescription. And I wanted to talk to you today about the role that art plays in improving health and well-being and offer a few suggestions for how you can integrate art into your daily life. It's really been my vocation as a museum educator to try and forge connections between a work of art and the visitor in order to find meaning and enrichment. This process of looking at a work of art is always a collaborative process, particularly if you're viewing a work of art with someone else. It often elicits discussion, debate, and a new perspective about what is being seen or what is not seen and what more can be found. If you think about an art student and how they're trained, they are formally trained in observation, how to interpret images by scanning and discussing to find meaning, decoding. And the same could be said if we think about the training of medical staff. Both rely upon practices of interpreting nonverbal and visual cues to draw conclusions. And these two fields, art and medicine, are not mutually exclusive. This idea that gaining skills and observation and critical thinking starts at an early age as we're children, as we start taking the world in, is very much the same pattern that we take with us as we move on into adulthood. And it's really my charge to dispel the myth that art is only for viewing in a museum or can only be created by professionally trained artists. Art is truly a vehicle that helps us to process illness, see another person's perspective, decompress, and the arts can also help us build resiliency, particularly over the past 18 months as we are still encountering the pandemic. So where is the data? What is the data? And briefly, there are numerous studies that have been conducted primarily around medical school and training of future physicians. And at least 3 studies have been conducted over the past decade that have concluded that medical students who participate in arts-based programming demonstrate better visual diagnostic skills than those students that have not received this training. We know that visual arts lessons for physicians can include drawing from live models, looking at works of art in a museum, but all of these sort of holistic approaches help with improving physical diagnoses, helping to improve acuity skills as well as communication skills. I am currently working on a study with OHSU, Oregon Health Sciences University, where we've developed a curriculum that will help us measure how empathy is improved, as well as how we can improve implicit bias awareness in med schools using art and narrative medicine language as a vehicle. Briefly, what are the benefits though? What can the arts offer us in terms of physical and emotional benefits? And we know that art is really a tool that can be used to verbalize in symbols, verbalize through performance, what is always not on the surface, what perhaps is buried a little deep. We know that art can help us improve fine motor skills, gross motor skills. They can help us increase strength if we're doing pottery, coordination, even dance. But art has the ability to elevate our mood, to release stress, to help reduce heart rate, to help with anxiety, and really to inspire positive growth. If we're thinking about the past 2 years, particularly, I know that most of the work that I've been doing is how the arts can help find respite for frontline and healthcare workers who are in need of decompression and resiliency building. And really, what does that mean? Many cases, it's been a 45-minute to 75-minute class that participants take in a Zoom setting with art supplies centered around a couple of different topics with no background or base knowledge of art. Really, it's this process of observing works of art, processing ideas, thinking about mindfulness and reflection, And these are quite accessible activities that can be done at home with materials that are just around you: tape, pens, crayons, even tissue paper. The beauty, though, that I have seen, particularly the past 2 years, is the work and the testimonies that happen through medical professionals and oncology patients, saying that this has given them a time and a space that has been helpful to help them process their pain, their grief, as well as reducing stress levels. So for you, there it could be as simple as listening to your favorite playlist or randomly turning on another playlist that you've never heard before and illustrating and drawing or painting what you are hearing. And it's pretty fascinating to see how that paper can illustrate what your ears are hearing. Other things that you can do: start the day with thinking about 3 words that describe how you're feeling physically or emotionally. 3 adjectives. Write them down on a piece of paper and illustrate the colors or the symbols that represent those words. You're welcome to click on the link that we've provided here. I have a number of prompts that you can use and think about throughout the day, ranging from just thinking about this notion of gathering. What does it mean to gather? Imagine that you are getting back together with a group of people that you haven't seen in a long time. You want to serve a beautiful table. What does that table look like? Perhaps you want to draw the plate or the textile or the candle or just that one meal. So again, art gives us a language that is always something that can help us connect with one another and also create an awareness of our own perspective. I wish you all creativity and good health, and I hope this was helpful.